Hello everyone, hopefully you're having a great Thanksgiving weekend so far. Today we're going to talk about the vascular and renal systems. Although on the course outline it did talk about the urinary system, we can make some type of connections with respect to diabetes and how it affects not only the urinary system but the mentioned systems that you saw right here. So we'll get into it a little bit in depth. I'm just going through this lecture just for you to have an understanding of what's going on with respect to the science here, and hopefully you find this useful. It shouldn't be a long lecture, but I just figured it would be good for you to understand, and hopefully this will be to your advantage. So if we look at the objectives for this week, we're going to define ischemia and the diseases that can be impacted by it. So ischemia is a very crucial aspect that could really have an impact on your bodies. It could lead to a lot of diseases. So there are some surgical procedures and tools to use that can correct improper blood flow, and we'll talk about it a little bit more when we get through this lecture. And then also we're going to review case study 8, which is the case study we are working on this week, and we are doing a different type of report this week. We're doing an operative report. So this will be the third report that you see, and this will be included on the test. I will give you further information on that, but we'll start with ischemia and talking about it and what's so significant. But before we get there, why not talk about the case study and to let you know what's going on today. Right, so the patient's name, Chapman Robert Kinsey, 87 years old. At admission, he was found to have acute renal failure. So what that means, acute meaning very temporary, it happened all of a sudden. Renal failure, so renal pertaining to the kidneys, and failure, so sudden kidney failure, which obviously is not a good thing, because if you can't filter out anything via the kidneys, will ultimately lead to death. And so he does suffer from ischemic necrotic toe and atrial fibrillation, right? So if you heard this in medical science, the heart chambers are known as the atrium. Fibrillation is when the atrium are not contracting properly. The whole contraction procedure is out of whack, and that's why, if you of course have heard of defibrillators, is used to shock your heart and to put its heart rhythm back at normal or homeostatic rate, if you want to call it that. Arterial Dopplers and arteriograms revealed severe infrapopliteal occlusive disease. So we'll talk a little bit about that when we get there. And the operative procedure was a left popliteal anterior tibial in situ saphenous vein bypass graft. You're probably wondering, what did I just say? Well, if we look at left popliteal, it's underneath the knee, right in the back portion, posterior aspect of the knee. Anterior tibial, so once again hovering around the back knee, in front of the tibia, anterior tibial. And then saphenous vein bypass graft, which we'll talk about in a moment. That's the procedure that he needed. Okay, so let's just go back to ischemia. What does this all mean? What's important about ischemia? Ischemia is essentially an insufficient supply of blood to an organ, usually due to a blocked artery. So the way to look at it is blood flow in your vessels is insufficient. It could be due to a blockage. It can be due to damage of that vessel. And if we break down the word, isch is deficiency, emia is blood. So if you really think about it, as you are all aware, we need oxygen and nutrients to our tissue. And the only way that we receive that is through blood flow. Our red blood cells carry the oxygen, and then there's sugar, whatever nutrients we need to get to that tissue. Right, so if you think of your foot, for instance, it needs that tissue. It needs oxygen to make sure that tissue is alive. So once we start limiting blood flow and we can't get that nutrients and all the oxygen supplied to that specific tissue, it starts to die off. And that's when gangrene can occur, when your skin becomes black and blue, like because it's not receiving what it needs. It's like you not eating. If you're not eating, you're eventually going to die. Well, it's the same thing as you not feeding your tissues with oxygen and nutrients that it needs to survive. So because of that, it could be a blockage. So if someone who suffers, who has atherosclerosis or any type of buildup in their vessels, it will ultimately cause them to lack the blood flow that they need to whatever area. And today we'll talk about specifically what area is being impacted. Okay, so the ischemic foot. Okay, if you look at that picture right there, not a very pleasing picture, but we're going to talk about what's going on with the ischemic foot. So ischemic ulcers usually develop on the feet, frequently on the heels, tips of toes, or between the toes in a patient with vascular disease. So once again, if we have that blood flow being limited, it's not going to areas such as the foot, which is the lowest part in our body, and of course where our body has to fight gravity to get that blood flow going. So that's a very common area for where ischemia, lack of blood flow, will result in possible necrosis, which is tissue death. These ulcers can also occur in the nail bed if the toenail cuts into the skin, or if the patient has had recent aggressive toenail trimming or an ingrown toenail removed. So in other words, taking care of your feet is very important as well. Moving around, getting your feet moving, that all has an impact, right? When you're moving, walking a lot, that promotes blood flow, right? Because when you walk, right, we squeeze the blood back to the heart where it stays in the foot. Even after you go for a run, they say not to stop running, or at least keep moving after the run, because you've been using your legs for so long, and what ends up happening is that there's a pooling of blood in your legs, because at that time most of the blood flow needed to be at the legs because you're moving your legs so much. So if you're not moving your feet, if you're not if you're gastrocnemius, not moving, which is a result of moving your feet up and down, which is known as plantar flexion and dorsiflexion, you're going to promote pooling of blood, and it could lead to some bad stuff if you do it on a frequent basis. So poor arterial circulation into the foot is a result of this. So it can be arterial blockage from cholesterol deposits, arterial blood clots, arterial spasm, or arterial injury. So if you really think about this, arterial meaning it's the blood vessels going away from the heart. This is where most of the blockage is going to occur. Because the thing about veins is they have these valves that basically prevent backflow of blood. So with arterial circulation, we want to make sure that we're getting blood away from the heart all the time, right? That we're constantly, there's constant blood flow. It's like a river that doesn't stop. It's just constant. We don't want any blockages. We don't want anything in the way. All right, we'll move on. Some of the symptoms, as you can see, the picture, not an ideal picture. You can see the picture on the right. That's some tissue death right there. That's dead tissue that could possibly lead to an amputation. So you'll get cold feet, right? If you're not getting blood flow to that specific area, keep in mind that blood flow involves a lot of movement, right? There's movement going on, so there's going to be some thermal effects. Purple or red discoloration of the toes. So as you can see, if the tissue is not getting the supply it needs, if you look at skin that isn't dead, you look at your own skin, right, it's a complex color that it needs to be. But if it's not getting the nutrition or oxygen that it needs, it's going to start to die off. Muscle cramping after walking short distances. So intermittent claudication. Intermittent claudication. So claudication, once again, is just a disruption. It can be, in this case, it's cramping. It's a disturbance. A sore that won't heal. So an ischemic ulcer. So if you think about it, if you're not receiving blood supply to that specific area, well, your ability to heal is going to be insignificant, because you're not receiving any supply of nutrients, any supply to promote any process of healing, right? Because when something heals, we need blood to get involved with it, and the circulatory system or the vascular system is totally essential to keep our body functioning. So that's very significant. And pain at night while resting in bed, right? So when you think about it, we're trying to pump so much blood to this area and it's not working, and it's going to result in some type of pain, right? If you think about going to bed with something like that, that's obviously going to cause some type of pain. It affects the nervous tissue around as well, so it all has an impact. And tissue death to part of the foot, which is known as gangrene, which is what you're seeing in that picture. Okay, what are the causes? What causes all this? If you even look at the bottom picture on the bottom right corner there, right, normal skin, if remember from last week, we had the epidermis, hypodermis, and the dermis, and then the subcutaneous layer. So that would be the fatty tissue. If you see that yellow layer, that's the bottom layer of skin. So if you look to the right, the ulceration, you can tell what it is. It's just literally an open hole in your skin. So what causes all this? So cardiac problems, once again, lack of blood flow. Arterial blood clots, right? So in your arteries, there's a buildup of cholesterol. So if someone is eating poorly or is not getting enough exercise or smokes a lot, you're promoting blood clots in your arteries. Injury, right? So if you get a bad cut, right? If you badly cut one of your veins or your arteries, you're not going to be able to get the blood flow there if you slash a major artery in your leg. So like the femoral artery, we're going to see some. You're going to see a bunch of different arteries that can be impacted. Diabetes, right? So diabetes, build up of sugar in your vessels, and what ends up happening is because you cannot metabolize the sugar due to not having insulin, the sugar starts to build up in your vessels, and that also causes a blockage. So if you've ever heard of a diabetic who had to get an amputation, it's because that buildup of sugar, they weren't taking their insulin, and as a result, blood flow can't get to the lower part of the leg, and that's why you'll hear about the diabetics having amputations because of that, because they're not taking care of their diabetes. There isn't enough insulin in their system to properly metabolize sugar to have a regulated blood sugar level. So that's why you hear about those diabetics who end up getting amputations. It's not ideal, but it's something they're aware of and they need to make sure they're taken care of. Vascular problems, right? So once again, all related to this. Okay, so this patient we were talking about, severe infrapopliteal occlusive disease. It sounds complicated, but it's not as bad as it is. So if you look at the picture on your right there, we're talking about the femoral artery that is having an impact, and the popliteal artery as well. So femoral, think about your femur. It's within that area, within that region. Okay, so let's talk about it a bit. This is a vascular disease due to occlusion between the femoral artery and the popliteal artery. So an occlusion, once again, blockage, plaque buildup, right? If you look at that picture, right, it's a buildup of plaque, anything that's going to obstruct the blood flow in your system. And if you look at the bottom right picture, it says arteries become narrowed and blood flow decreases in arterial sclerosis. And then if we take a look at the picture, you can see there's an artery in the lower leg, and it's a buildup of fatty substance in the wall of the artery. That's why it's so important to move. That's why it's so important to exercise, because you're promoting constant blood flow. You're promoting increased blood flow. You want to make sure that not only your blood flow is consistent, but when you exercise, you are basically what's the word I'm looking for? But you're disrupting the system in the sense that instead of normal blood flow, right, you get involved in vigorous activity and it increases your blood flow, right? Because you're moving and your heart has to beat faster, and then there's more blood flow being promoted instead of being still and allowing plaque to build up. Okay, and the popliteal refers to the hollow section at the back inferior section of your knee. There is a muscle there called the popliteus, so you can make the connection that popliteal is referring to the knee areas. And if you go and feel that back area of your knee, you can feel almost, it's like you got a bone over there, right? You got the femur, and then right underneath, it's almost like a loose skin area that we're talking about that. So in between that area, you have the popliteal artery. And so it's happening within the knee area. If you look at that picture at the top left, top right, sorry, you can see, right, that's where all the buildup is happening. So it's literally, we're talking it's severe, of course. It's definitely severe, but we're talking about that specific area. It can happen in almost any area of the leg, but in this case, that's exactly where it's happening. Okay, and of course, there's a blockage of the vessel, which is again is going to lead to tissue death, right? Because if you don't have any blood flow, or it's being limited, right? Once again, those specific tissues that do need it, they're not receiving it because of the buildup of plaque in the vessel, limiting blood flow. Okay, what are some of the symptoms of these? So what are you going to feel, or what is the patient feeling when this episode is occurring? Okay, so once again, ischemia, lack of blood flow, blockage, right? Very straightforward. Look at this picture on the right. Okay, the plaque reduces the blood flow. Muscle below the blockage begins to die. So if you look at the picture of the left section there, you can see blockage is within the knee area. Well, since blood can't get there, that's where the tissue damage starts to occur, and your tissue is going to die. Once it's dead, you cannot revive it. Just like realistically, if someone dies, you cannot revive them unless there are certain circumstances. But once someone is pronounced dead, you cannot revive them. Same thing happens with your tissues. Pain during rest, right? So you are, of course, feeling this pain because you are not receiving the nutrition that it needs, and it's almost your body calling out that, hey, we're dying here, this tissue is dying, and pain is a signal. Atrophy. So atrophy is a name for shrinkage. So I don't know if you've ever heard of muscle atrophy, right? So if you broke your leg and you can't work out your leg for a while, you take off the cast, you notice that your muscles have shrunk. That is because you haven't been using them. You haven't been promoting any movement, which in result will lead to atrophy. So once again, shrinkage of tissue. Cyanosis, so a bluish discoloration of the skin, right? Like you saw in the other pictures. Cyanosis, so cyano is another name for blue, and osis is a condition. So put it together, bluish discoloration of the skin, and that's because that's your tissue dying. That's what happens when the tissue dies. It starts to there's a discoloration. And of course, necrosis. So this is tissue death, right? So think of all the millions of cells that make up the skin. Those cells are starting to die. Okay, so what happened? What had to happen? Okay, if you look at the three pictures, we had to do something called a bypass graft. Okay, so bypass graft. Let's analyze this right here. Okay, what a bypass graft is using a patient's own vein, and in this case, because it's a big artery we're dealing with, the femoral and the popliteal, we're going to use the saphenous vein to redirect blood flow from an area of blockage. So he has a blockage in the leg. If you look at the picture of the right, what we're doing is we're literally taking the saphenous vein, we're taking a piece of it, and then which is known as the graft, the actual vein, and then we're attaching it to bypass the blockage between the femoral and the popliteal artery, right? So if you take a look at that picture on the right, we literally took a chunk of his own vein and we're using it to bypass it. The best analogy for this one is think of traffic on the 401 during rush hour. There is a blockage on that lane. Think of the highway as the vessel and a bunch of cars as the red blood cells. Okay, if there's something blocking it, such as an accident, we cannot get any flow of traffic to go. So, what do? Okay, the express lane looks nice. It's not as busy. Let's go in the express lane. There's still some type of flow of traffic going. Think of the graft as the express lane. Okay, we got a blockage due to some type of accident. Well, let's use the graft, the express, to continue that blood flow and to bypass that traffic. It's the exact same concept as this. We want to make sure that there is blood flow occurring at this time. So what ends up happening is we put this graft, and instead of the blood flowing to that blockage, it's going to start flowing into the graft, and it's literally going to bypass that blockage. And because of that, we can continue to have a normal blood flow. Keep in mind that these major veins and arteries are the ones that are needed to distribute the blood to smaller vessels, arterioles, capillaries, in which then we can supply the tissue with the nutrients that it needs. But we need these major arteries to play a role, because if we're not getting those major, think of it once again, if you're not driving, you have to drive on the highway to get to one place to another. To get from Toronto to Montreal, you need one major artery, which is the highway, to get to the little tiny streets in the city. Same concept with this right here. We are trying to get to the little areas within your body to make sure that blood flow reaches every tissue that is needed for supply. Right, so this is the surgery that happened. It can be recommended to bypass the blocked artery or to clean out the area of blockage. So this was the procedure, the operative report you're going to talk about today. Okay, so now, this is pictures of the procedure, and if you see on the picture on the left here, you have all the arteries, the major arteries. So you got the anterior tibial artery, think about it, it's in the front of your tibia. Posterior tibial, it's in the back. Peroneal is another area of the leg. There's a peroneus muscle. Dorsalis pedis. So dorsalis, it once again is it's a muscle that leads to dorsiflexion. You can see these are major veins. The femoral vein and the great saphenous vein, the small saphenous vein. It's like it's a cool network. It's literally a highway network in your body to distribute these tissues to wherever it's needed. And then let's take a look at the bottom right picture. So the length of the saphenous vein in the leg, it's quite large. You have to open it, literally make a huge incision. 25 to 30 centimeters of the vein is needed from the leg. So that's a lot. That's a lot going on there. And you're probably wondering, okay, so if I get rid of that vein, what happens to the blood flow for the vein that we just removed? All right, keep in mind that there are millions and millions of veins and vessels. So it's kind of like a detour on the highway. If blood can't get to that area that you cut off, it's going to find another way, unless, there isn't a blockage along the way. So we'll take a piece of vein out. Yes, we need it as a graft to relieve a blockage. But keep in mind that if there's think of the highway, if there's a permanent closure, well, you're going to find a way to get to where you need by detouring. So that's what happens in the blood. Okay, these are just some of the equipment or the tools that we're going to be using. Pot scissors, heparin. If I could just ask you to look these up on your own. They are also on the quiz, but when we're going through this, since you're going to have a little bit more time to do the case document on your own, just take a look at these, understand what they mean, what's significant about it. This is something I'll let you do on your own. Okay, we're almost done. We're at the operative report now. This is the new report. This will be the last report, the last new report that you'll need to work on before we get to the test. Okay, it's dictated by the physician immediately after the completion of a surgical procedure. Okay, so we're knowing that the physician is involved. It includes preoperative and postoperative diagnoses. Right? Keep in mind, diagnoses, that's plural. Diagnosis is singular. So preoperative, okay, we're going to diagnose before the operation, and then after the operation, postoperative, there will be a diagnosis. Okay, so the body of the report, the findings and procedures, is dictated in a narrative form, right? So just like what you've been hearing the whole time. And it contains information about the patient's condition after surgery. Right, so that's basically, this is the report, this is the operation, what happened before, what happened after. And if you look at this example right here, you can see there's a lot of specific information. And if we go to the bottom, you'll see description. Right, keeping in mind that when we are doing these reports, that you're going to put down what you hear only. Don't put anything that is not there. And then in this case, description, right? It's literally describing the report. So you can have all this pre-report information, and then the first subheading is going to be the description. So please follow the same procedures, right? You're bolding it, left justification. Nothing has changed. It's just a little bit more information. So take your time with this. Really make it look good. Make it, because we've been getting all this practice, make it look ideal. And you'll see the only difference here is what they're asking you to do if you're going to go to a page 2 is to quadruple space. So when after your page 2 heading, 4 spaces down to continue. And if I go back, I won't go back now, but you could see all it was, the subheading was a description, and literally they're just describing what happened during the operation. And then at the bottom you have the signature line and your sign-off block. So realistically, this is just specifically pertaining to the operation. Okay, so here's all the doctors' names that you should be hearing during the dictation. The audio report is going to be posted this evening, so Sunday evening at 7 p.m. Stay tuned. I will have that on the news post. But this, please, one thing I did notice about the previous reports, some people were misspelling the doctors' names. Okay, think of it as the same thing as a resume or a cover letter. You misspell the employer's name, what do you think they're going to do with that report? They're going to crumble it up and try and make a nice free throw right into that garbage. You cannot misspell names. Okay, it's very essential to make sure that the names are spelled correctly. I did have to deduct some marks from some people because of that. So let's be very mindful of that. Okay. And the submission. So I'm asking for you to submit it specifically. It's going to be due Tuesday at 11:59. Extra time to enjoy your Thanksgiving. Hopefully it's been a great weekend. Quiz number 5 is also available. I recommend you do quiz number 5 beforehand. If it's not submitted past this time, it's a mark of 0. No exceptions. And this time, if you don't mind, please save it as first name, last name, underscore, case document 5. Very straightforward. So your first name, your last name, and the case document. Okay, just going to talk a little bit about the test. As you know, it's going to be written a week from tomorrow, Monday, October 17th. It will be open book and practical. So basically, just expect to come in. There's an audio file, start listening, and let's get it done. Expect to write either a discharge summary, diagnostic imaging report, or an operative report. So I can definitely assure you it will be a report, and a report that you have practice. So I'll also put some practice audios on that. They will become available. And just study everything. Just have an understanding of what's going on. Understand the reports. I would go through the basics, right? The sign-off block, understanding the page 2 header, all that stuff, and just to make sure you're familiar and comfortable with it. We've been practicing every week now. I'm going to put some more practice dictations, but for the most part, everyone's been doing really well. You're going to have the textbook available, so realistically, this type of studying is more practice than it is studying the actual content and information. But obviously be familiar with the medical terminology as well. That's very important. Okay, any questions between now and then, please send me an email. I'll be happy to answer any questions. And I wish you all the best, and I will see you all next week. And hopefully next week we can still talk about the Blue Jays being in the playoffs, and hopefully they get the game win tonight. Go Jays, go. Happy Thanksgiving. I am done. Take care.